Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we have our Gold Neonatal Conference coming up here for 2022, our online conference. And one of our speakers is with me here today, Dr. Tiffany Gwartney. Welcome, Tiffany.
Hi, Kristen. Thank you for having me.
It's absolutely lovely to have you here today. So thank you so much for taking time out of your busy schedule. And before we talk about the actual topic that you will be presenting on here with us today, tell us a little bit, first of all, this is an international conference. Where in the world are you?
Oh, that's a great question. I'm actually videoing today from the state of Florida in the United States, which I'm a fifth generation Floridian, which is a big deal. My family has been here for a very long time versus other people who have recently relocated in mass to Florida.
So you are indeed a fellow Floridian, although I can't claim I'm also located in Florida on the East Coast. I am not a fifth generation, as you may hear from my accent, but it's very rare to meet somebody who's really been here for that many generations. So that's wonderful to know. So Tiffany, tell us a little bit about your work background. You are a professor, right? And tell us a little bit about your professional journey.
Okay. Well, let's see. I think I began working as a nurse back in 2000 up in the Chicago area, which is why I have a little bit of a funny accent myself. And I kept pursuing my academic goals incrementally until I got my doctorate. So I became a neonatal nurse practitioner in 2010, I think it was, and began to practice. I still practice in the NICU, mostly in level 3 and level 4 NICUs, which if you're not familiar with that, that's the NICUs where the babies are most critically ill. And that's the population that I like to work with because I like to see them go from being so very sick to going out the door with their happy family and growing up and becoming, young, thriving individuals. So I do still practice clinically. And then I've been a professor for about 7.5 years now with University of South Florida. And I've enjoyed that a lot. I'm teaching in the College of Nursing and mostly with undergraduate students. So it's their very first nursing degree. And they're an incredible bunch to work with as well, because they're just so excited about nursing and you kind of get to work with them and really put a mark, if you will, on their blueprint before they go out into their nursing career and have different experiences that way. So I really enjoyed that work as well.
That's wonderful, especially when you mentioned working with these young people who are still so enthusiastic and passionate. And I think it's wonderful to see that these young professionals going out in the field and working there and serving all these families with those vulnerable little ones. As you said, you want to see them going from coming to the world very early or having all kinds of medical situations there to going home with their families. It must be very rewarding work there too.
Yes, absolutely.
Now you have, obviously we are in 2022, so you have been working with your students and in the NICU through COVID. So tell us a little bit about that experience. And I know you put something in place, if I'm not mistaken, some kind of simulation as well with regards to that. Can you tell us a little bit about that?
Yes, absolutely. You've been doing your homework. That was you had to dive pretty deep to find that, but it's one of my works that I'm actually most proud of because I was working clinically at the time that COVID arrived in our nation. I think I was able to understand what the needs were going to be 2 steps in front of COVID, and maybe 1 step in front of hospitals and universities and things like that. So I just kind of took a temperature of the landscape and realized all at once, I think it was a Saturday in April of 2020, that our students were going to have to be uniquely prepared for the things that COVID would bring to them. And at that time, I think that's when we were seeing major shortages of personal protective equipment and things like that. So I essentially started to find whatever I could in the literature and bring it to the students and create a module for them to go through with the learning management system at the university and learn what COVID was so that they could sort of replace their fear of the unknown with knowledge. So we had to also do that kind of to get our students back into clinicals, because at the time, all of our clinical partners had prohibited students from coming into the clinical situation because nobody knew what COVID was and what we were doing with it and things like that. So it was a way for the students to gain access back into the clinical setting, because by the time hospitals were prepared to allow students to come back into that setting, we were sitting there saying our students are fully prepared. We integrated this into our curriculum months and months and months ago, and they know what the enemy is, if you will, being COVID, and they know how to respond and react to that, and they're ready to get back into the clinical setting and help our clinical partners with literally any of their unique needs presented by the pandemic. So it was a really incredible experience, because that's a big win. That's a proud moment as an educator, because you see them sort of go from being catatonic because they're so afraid to being knowledgeable, to being so knowledgeable that they're teaching nurses and things like that about the things that they've learned. So it was really, it was a very hard time, very exhausting time, but very rewarding ultimately to be able to help the students, support the students through that and guide them. And more importantly, probably on their paradigm, is help them graduate in time, despite the fact that they weren't able to continue their clinicals in spring of 2020. So
what an amazing accomplishment there, Tiffany. Well done. That's absolutely fantastic. And it's an area we don't hear much about. So I'm very grateful that you talk about this, because we hear about nurses and staff in the situation on the ward, in the NICU, right? But, there's very little known about the students who are coming or were coming in that time or still coming in, how they were prepared for it, did they feel, and this feels like you've put so much into this to prepare your students that they felt even better prepared than some of the staff, so they could teach them. That's what an accomplishment. That's great. Fantastic. And let me ask you this now with that. Let's say, okay, we're still in COVID. This is probably not going away anytime soon. This in your curriculum, this will stay, right? And is this something that could be implemented or taken for other pandemics or other situations in the future that could arise?
that's a great question. We tried to, so I say we, because there were people in, for example, the educational design and technology department in our university that helped take this literature that I was finding and make it conducive for learners to go through and actually learn something and have it be integrative. And that's where that simulation came from that I was able to write and film. I forgot to tell you that, I met with other faculty, because we didn't, while we typically use actors in our simulations, it was the pandemic. So we weren't able to get actors. So it was our faculty members videotaping this interactive simulation. So it actually turned out to be something that the students enjoyed on a different level that we didn't anticipate, because they were able to see their faculty and sort of interact with their faculty in a time that everything was closed down and they were feeling isolated. So, but to answer your question, we tried to build that learning module with the foresight of making it something that is not specific to COVID and specific to this pandemic and things like that. Really, really focusing on basic principles of infection prevention and donning and doffing, or taking on and taking off your personal protective equipment and things like that, that the students could take with them and use throughout their nursing career. The other thing that was sort of, I'll say, innovative about that module was it was literally a Band-Aid. It was a standalone learning module that we could integrate into whatever course that we wanted, whether the students were just graduating or just starting nursing school. And then shortly after we got our legs under us with, probably phase 1 and phase 2 of the pandemic, we quickly learned that we needed to integrate that information throughout our curriculum. It's similar to a new disease like congestive heart failure. What if that didn't exist yesterday and it exists today? So how do you figure out how to integrate that into your nursing program so that students have an awareness of it? So it was pretty unusual. It was an unusual situation because I don't think we really had any kind of disease or pathology or anything like that we were trying to integrate throughout the existing curriculum before COVID. So it was really, it was interesting. And like I said, fortunately, we had the forethought at the time to build it in such a way that it can be sort of broken apart and placed throughout the entire curriculum for the whole program that the students are in. So we took sort of the basic infection prevention concepts and we put them in the beginning of the program because we knew students would need that first and foremost before they started taking care of patients and so on and so forth. So it worked out pretty well. It was a bridge. got to the other side of the bridge successfully, I'll say. So it was an interesting, and I was almost going to say fun work. It was fun for the same reason, that you could see the students sort of have that aha moment and get excited about taking care of patients again and things like that. So.
Right. And give them the knowledge and the skills. That's absolutely fantastic to prepare them. Wonderful. So yeah, you have such an amazing background, and you are not only, you're working in the field, you're a lecturer, but also an author. You just told me earlier that you are authoring, I don't know, is it complete yet? Chapters in a textbook?
Yes, ma'am. So I think this textbook is going to be released sometime this summer, but absolutely. I had the honor and privilege of writing a few chapters in a neonatal pharmacology textbook that is specifically written in mind, I should say, with neonatal nurse practitioner students in mind. So it really caters to their level of understanding. It gives them a lot of historical background in terms of why we provide the medications that we do for different disease processes and things like that. So I think that's going to be coming out, like I said, this summer. Dr. Amy Janal is the senior author, and it's, I believe Springer is the publisher on that. But it's just fun because each chapter has a different group of neonatal nurse practitioners, pharmacists, neonatologists, and things like that. And when you look down the names of the co-authors, it's just such a small niche that we are in neonatology. And so it's kind of this beautiful work that we're bringing forward as a collaboration. And I can't wait for students to see it and interact with the information and see what they think about what they're reading and things like that.
Absolutely beautiful. Thank you for sharing that. Now let's also talk about your presentation here at Gold. And the title of your presentation is Current Trends in Identifying and Managing Neonatal Diabetes Mellitus. Fascinating. I have to tell you, it's fascinating. But let me ask you this. Am I not mistaken, or is it a very rare disease, or is it something you see more often now? So tell us a little bit about it.
So that's a great question. And that's actually why I decided to kind of delve into this topic. Each neonatal nurse practitioner and each neonatal nurse and each neonatologist has their population that they enjoy working with, whether it's babies who have intestinal issues or babies with cardiac issues. This is an endocrine disorder. And frankly, that's not one of the populations that I particularly enjoy working with as one of my favorite populations. However, probably 12 years ago, I would say, I had a patient who had neonatal diabetes. And the thing that made me really passionate about the topic was that this baby had been in our NICU for quite some time. And then all of a sudden started having hypoglycemia. And it took us such a long time to figure out that was what was going on and to treat that baby properly. And by properly, I mean in a way that would allow the child to be able to go home faster. So while we were spending so much time trying to figure out what her disorder was, it was delaying her discharge. So that's why I became interested in it, because, and you'll see in my talk, the nature of that disease is the sooner you can diagnose it, the more narrow, if you will, the treatment path becomes. And because the treatment pathway becomes narrow, that sets the child up for euglycemia, or being able to regulate their glucose almost immediately, and can get them discharged from the hospital very, very quickly thereafter, once they're stabilized on the treatment that's appropriate for their disease. But to answer your question, yes, it's absolutely very rare in the newborn population. And that's also partly why I like to give lectures on it, because it was the zebra that walked through the NICU, you know?
Yeah,
We didn't.
absolutely. Yeah.
Yeah.
Yeah, exactly. That's something, nobody expected, nobody probably looked at, right? And these zebras are the ones that throw us off. So it's good to learn about them, so things can be discovered quickly and treated accordingly, right?
Yeah, absolutely.
Well, wonderful. Thank you so much, Dr. Tiffany Gwartney here, for spending time with me here, talking about the amazing work you're doing with your students in the NICU as well, and as an author, and here also as a presenter with us at Gold. I can't wait for your presentation.
Thank you so much. I can't wait either.
And for our viewers now, this presentation is part, as I mentioned, of the Gold Neonatal Online Conference of 2022. We get started just around the corner here on May 31st with our open access keynote presentation that you can check out. And Tiffany's presentation will be live on June 6th. So if you would like to find out more about this presentation and all the other presentations in the conference, we invite you to go visit goldneonatal.com. Thank you, everyone, for watching, and I hope to see you at the conference. Bye-bye.
Thank you.